Imagine coming into a patient room to give them their breakfast few minutes after they've had their insulin, only to discover that the patient is difficult to arouse, the patient is drowsy. What do you think will be happening? Hello everyone, welcome back to my YouTube channel, Nursing with Beatrice. In today's video, we'll be looking at the types of insulin. So we'll be looking at the 4 types of insulin: rapid-acting insulin, short-acting insulin, intermediate-acting insulin, and the long-acting insulin. We'll also look at how to mix insulin. So let's begin. So the first type of insulin is rapid-acting insulin. So this one is the fastest of it all. As the name goes, rapid, so it's very, very fast. The onset is between 10 to 20 minutes. The peak time is between 1 to 1.5 hours. And the duration is around 3 to 4 hours. So this is the insulin that when you are to give it to a patient, make sure that the food is already served, it's on the table, and the patient is actually ready to eat. If you don't do that and you give this insulin and come back later to serve meal, or you assume that, oh, the food will be there in 30 minutes time, before you come back, something is happening. The insulin is beginning to work, it's beginning to act on the existing glucose in the body, and then the patient can go into hypoglycemia, can go into coma. So to avoid that, make sure the food is right there with the patient before you give the patient the insulin. You would have confirmed that the patient is willing and ready to eat immediately after administering the insulin. To help you remember this one, because the time kind of look long, so it may be hard, so I just put something in the bracket. So 15 minutes as onset, 1 hour for peak, duration 3 hours. Example of this type of insulin are the Humalog, which is Lispro. We have Novalog, Aspart, and we have Glulicin, which is Apidra. Then the second type of insulin is the short-acting insulin. So these ones are the regular insulin. Those insulin that you see with R at the end, they are the regular insulin. So this regular insulin, the onset is 30 to 60 minutes. So from 30 minutes, it begins to work. Peak is 2 to 3 hours, and duration is 6 to 8 hours. So for this one, to help you remember, 30 to 8. So 30 minutes onset, 2 hours peak, duration 8 hours. And examples of these ones are the Humulin R, Novolin R. So this one, just like rapid-acting insulin, it's short-acting. It begins to act fast, though the rapid is more like that one acts faster than this one. But the same thing for this one, ensure that before you give this patient this insulin, the food is almost ready or is available to be given to the patient. So in other words, since this one start acting between 30 minutes onward, it should be that the food is already in the environment before you start giving, and the patient is also willing to eat. This short-acting insulin is the one we put in the bag. So if you are titrating insulin in an IV fluid, these regular insulins are the most commonly used. The third one is intermediate acting insulin. These ones are the one we call NPH, neutral protamine hagedon. So this one, as it says, intermediate, so it's neither short or rapid acting, neither is it long acting, it's in between. The onset is between 2 to 3 hours. The peak time is between 6 to 8 hours, and the duration can last up to 16 to 18 hours. So to also help you remember this one, you can use what I've put in the bracket 2, 8, 18. Examples are the Humulin N and Novolin N. So any insulin you see that has N as the ending is mostly going to be intermediate, the NPH. If it is R, it's going to be the regular insulin. Then the fourth one is the long-acting insulin. So this one, as the name goes, long-acting, it lasts for the whole 24 hours. So the onset can begin from 2 to 3 hours, just like intermediate-acting insulin. The peak time, there is none. So take note, no peak time. So I put for peak time, 0, none, no peak time. Duration can last up to 24 hours. So these are the ones we give to patients overnight. Examples include Glargine, which is the popular one we call Lantus. We have Detamir, and we have Degludec. These are the common examples of long-acting insulin. So the good thing about for long-acting insulin is that there's a less risk of hypoglycemia because it doesn't have a peak time. So when the patient take it, it's just going to keep working for 24 hours. So for this patient, it's not that they will not eat before you give them, they will not eat after giving them this insulin, but it doesn't matter even if there's no food available at that point, it's not going to peak. So it's not really, there's no risk of hypoglycemia. Mixing insulin. The purpose, why do we want to mix insulin before giving? The main purpose is to prevent giving two injections. So that's also to help promote comfort instead of pricking the patient multiple times. And the rule is regular plus NPH, which is the clear before cloudy. The regular is the clear one, the cloudy one is the NPH. And that makes sense because if you withdraw the clear one before cloudy, you're able to see properly the calibration. But if you withdraw cloudy first, it's going to blur the syringe. You may not see properly. Never mix any insulin with long-acting. So the long-acting insulin, we don't mix it with any other type of insulin. They are on their own. How to remember? We just say, oh, long-acting insulin, they last for 24 hours. So because of that, I don't mix it at all with any other insulin. That's the way I remember it. So steps to mixing insulin. The first one is to mix the cloudy one first, the NPH. And to do that, you rotate the cloudy between the palms of your hand. You don't shake it. And then the second thing is to clean the vial. So each vial, the vial, the regular, the vial, the NPH, you clean the vial. That's the second step. The third one is to inject the unit of air into the NPH first. So because we are doing, don't mix it up. When you are going to withdraw finally to give, you are going to withdraw the clear first. But when you are mixing, the first thing is to push air into the NPH, the cloudy one. So you put the exact unit of air, I will demonstrate it with an illustration, into the NPH. And then you inject the unit of air for the regular. You inject it into the vial. Now, once you have injected the amount of the unit of air for the regular, you don't remove the needle this time. You quickly flip it upside down and withdraw the amount of regular. After you've withdrawn the amount of regular, put that needle into the vial of the NPH. You have cleaned both before now, and then you withdraw the NPH. That's how you mix insulin before giving. Now, let's see an illustration of what I'm trying to explain. An order says give 6 units of Humulin R and 8 units of Humulin N subcutaneously before breakfast daily. So to mix this, so the Humulin R there is the regular insulin and the Humulin N is the NPH. And we are told to withdraw 6 units of that regular and 8 units of the NPH. The first thing, we're going to mix the NPH, which is the Humulin N, by what? Rotating the vial between the palms of our hands. Then the next thing, we clean both vials. Remember, before you even start all this, you would have done your hand hygiene. So I don't need to mention that again. You would do your hand hygiene before you continue. You would have put on your hand gloves too. Then you inject 8 units of air into the Humulin N vial. So you put air first into the Humulin N, which is the NPH. After you've injected 8 units, which is what they asked us to put, the next thing is you inject 6 units of air into the Humulin R, because the thing says give 6 units of Humulin R. So you push 6 units of air into Humulin R vial. Once you have put 6 units of air into Humulin R vial, that needle, you no longer bring it out. You quickly flip that vial of the regular and withdraw and allow it by gravity. Actually, 6 units of regular is going to enter the syringe. You just guide it. Then after you've done that, then you remove the needle, put it in the Humulin N, and withdraw 8 units of that cloudy insulin to make up a total of 14 units. So that's how we mix insulin before giving to a patient. So that wraps up today's topic on the types of insulin and also how to mix insulin before giving a patient. If you find this video helpful, please like, share, and subscribe for more educational videos. Thanks for watching.